It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Studios of Money Radio, 1510, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if you are new to the show and you're listening for the very first time, our show is about how our older adult population can live a healthier, happier life. And how do they do that? They do that by tuning into this show. And it's not about me. It's about these extraordinary guests that I bring to the show. And today's no different. It's a guest that I've known for a few years, and we're just getting reacquainted. I'm real happy to bring into the studio with me Jayme Ambrose, and she is the founder and CEO of Adobe Care and Wellness. Welcome to Health Futures.
Thank you. Thanks for having me. It's exciting.
You know, I'm trying to figure out when I last saw you. It's probably been at least 5 years, 4 years. How long have you been doing Adobe?
Oh, yeah. It's been at least 5 years, because Adobe Care and Wellness, under my partner and my ownership, we're going into our 5th year. So
Wow.
It's been at least 5 years.
All right, I know a little bit about what you're doing, but my audience has no idea what you're doing. But
Right.
Listen, that you're a healthcare veteran, and you do critical care case management. You're a nurse.
Yes.
You have a lot of credentialing, and you are now doing this Adobe Care and Wellness. So tell us, what is that all about?
So Adobe Care and Wellness started out as just an idea. I was finishing my doctorate in nursing, and in one of our business classes, we were asked to put together a product that we would sell to the class. And so my partner and I, my classmate partner and I, put together this concept where we would sell case management services to managed care companies. And in doing that, we would focus on improving the quality of life for those seniors that we were going to be working with. And we put that together, and actually we sold it to the class. Our professor put all of her dollars into it. And as we sit here, actually 10 years later, my partner is utilizing it in her role in an ACO, and it then became an actual program through Adobe Care and Wellness.
Wow. I mean, it's incredible. I mean, here it is. It was basically a class assignment.
Yes.
And your professor put all their dollars into this because they were that convinced. You brought that concept together in the classroom, and now you brought it to reality.
Yes. So when we first started utilizing it, when we got our first contract, what I said to my team was that, okay, what we have now is a theory. We have a theory that if we do these things, we're going to improve patients' lives. And now we can say not only was that the theory is in actuality, we've experienced it, and we have the data to show that we've made it a substantial difference in many, many people's lives.
All right, so you've got the concept, and you've got the buy-in in your class, and now here it is. Fast forward 5 years later, but I know that you took a position in another company,
Mm-hmm.
and it sounds like to me, and I want you to explain to our listeners, the proof of concept was probably in that venture, right?
Yeah, absolutely, absolutely. I was very, very fortunate that when I finished my doctorate, I met up with Michael Sumner. He owned Beach Medical Group at that time. And we had a great conversation about healthcare and how healthcare needs to be different. how we need to be looking at it from a very integrated model of care and not the siloed model that it is. So one person does this and one person does that, and neither one of them talk. And so Michael gave me the opportunity to come in and work with him as I was the chief clinical officer for Beach. And then we worked together to get our first pilot contract. We put together that first pilot and actually proved, this is what we can do, which led to another contract and another contract. And then, 5 years ago now, Michael said, I want to go do something else. If you want to buy the company, that would be awesome. And I talked to my partner and I said, we need to buy this. And she said, okay. So we did. And we started off with 12 employees and the rest kind of right now is our history.
Wow. It's just fascinating. It really is. And, I think people, especially our listeners, don't really understand how important it is to have a case management oversight over somebody's health. And I want to kind of like dig a little deeper into why you saw this as an opportunity. And certainly, Michael has been a guest here on my show. It's been a few years. We just started our 9th year. So I think Michael's last visit was probably 5 or 6 years ago, and I love the Queen's English, and he certainly, even if he's not, if he distorts the truth a little bit, just the way he says it, I mean, it is just fascinating, and it's so believable. But,
absolutely.
but in any case, I oftentimes, and I know our listeners understand home health, and they understand how nurses and therapists and others come in and out of their home. But I want to dig a little bit deeper about case management and what you guys are doing. And there's this phrase that is often used that maybe the consumers and the people that listen to our show don't really understand, and that's social determinants of health. And I think that's something that really is a focal point of case management. So please, explain to our listeners and explain to me exactly what you all do.
Absolutely. It's the most important thing that we do, and I'm glad you brought up that concept of social determinants, because one of the key things that we do is we focus on where is your quality of life. And by quality of life, I mean what needs do you have that are not being filled that would help you maintain your health or, in essence, improve your health. So when we go into a patient's home, what we're asking them and what we're looking for are you able to pay your bills on a monthly basis? Do your utilities stay on? Do you have enough food? Are you safe in your home? Do you have the ability to pay for your medications? Can you get to your doctor's appointments? And all of those things are issues that we then look to resolve, because what we know is that if we resolve those issues, then you're going to have the time to focus on checking your blood sugar and your blood pressure and making sure your meds are set up in a pill box so you don't forget to take them, and talking more clearly to your provider because you don't have all these other stressors involved. And all of it is really based on a theory that was presented by Abraham Maslow. And so we run everything that we do on Maslow's theory, which says that if the very first thing I'm going to focus on is my safety, right? I'm going to focus on, am I safe? The next thing I'm going to focus on is, am I clothed and fed? And then the third rung of it, then I'm going to start focusing on myself. I can start focusing on those things that impact my health. And so that's how we do the case management process. And in the process of that, we then add to that all those healthcare supports that you need: a dietitian, a nurse practitioner, a social worker, a care navigator to come into your home and do all your testings in your home as well.
Well, I want to get more into this in the second segment. You can hear a little bit of The Who
Right.
playing in the background. If you're a fan of The Who, Baba O'Reilly is one of my faves. But in any case, I want to learn a little bit more about how you really overall look at the social determinants of health and how you can help those patients, those consumers, to better health.
Absolutely. I look forward to it.
You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and I got Jayme Ambrose here in the studio. She's from Adobe Care and Wellness. We're down one. We got 3 more to go. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment. I'm proud to have Jayme Ambrose here in the studio. She is the founder and CEO of Adobe Care and Wellness, and she's somebody I've known for a few years, but we haven't seen one another in close to 5 years, and she's been off and running with this company that is really changing lives every single day. And if you missed our first segment, go up to our website at cypresshomecare.com. Click on the media button. Third button down is radio show. You'll catch this one and many more. So, Jayme, when we left off on the second segment, we were talking about the social determinants of health. You were talking about Maslow's hierarchy, and I went to business school, and I understand that very, very well.
Very good.
And, we were talking about social determinants of health, and you were taking us through, what you as a case manager and your team goes through. And if you would, I want you to summarize where you were and then pick up where you left off.
Absolutely. So what we do as a company is we look at where are the social gaps, where are the needs in relation to finance, transportation, social isolation, loneliness, all of those kinds of things. And as we do that, we are then fixing them, right? We're identifying. And I have a great story for you. It's my favorite story to tell. We walked into a woman's home. She was 87 years old. And she said, look, I can't flush my toilet because my septic tank is full. I have no heating and air conditioning, and it was winter, and we were in Sierra Vista, so it was cold.
Yeah.
She said, if you can't fix those things, then I don't need you. So our case manager got on the phone and started calling all the local construction companies until she found one that said, we will empty her septic tank today, and we will put in a new heating and cooling unit for free as long as she is willing to let us use her name as part of our community services. So in one day, she got her septic tank emptied. She hadn't been able to flush her toilet in months.
Wow.
And by the end of that week, she had a new heating and cooling unit. And that's just one example of the things that we do. And it's one of my best stories.
No, it's a great story. I mean, let's face it. I mean, we know that nearly a third of our population, 65 and older, lives home alone.
4.9 million over the age of 65.
That it is so devastating to know that. And you know what? That number's going up.
Absolutely.
Dr. Joseph Coughlin, who is the gentleman that runs the MIT Age Lab, predicts by 2040 that number could be up to as high as 50%. And, we've got people that are on the poverty line, like you've just described,
right,
who are home alone that have no one advocating for them. And you and your team are taking on that role.
Absolutely. We do. And I think that's one of the crucial pieces for us to talk about is poverty in the elderly. In the state of Arizona, which it's running right nationally, 9% of those over the age of 65 live in poverty. But if you live alone, if you're widowed, that goes up to 15.8%. Wow. And when we look at those that live in the rural Arizona, that's averaging 13% of those that are living in poverty. So the issues that we're talking about, those issues of quality of life and social gaps, those are crucial to improving the health care and the longevity of the senior population.
Well, it's certainly it is something we need to address, and it's something that if we don't address it now, it's going to be out of control. And I love the fact that you created this company, and it started with 14, and now I think you told me you have over 200 employees. And,
yes.
And I would love for you to share with our listeners the scope of your practice, because it's not just Phoenix.
No, absolutely. In fact, it's not Phoenix. We the contract that we have that addresses case management. We cover the all of the rural counties. So we're not in Maricopa. Because the rural counties have the greatest need. There's the greatest gaps in services. It's beautiful. It's beautiful to live up north or down near Bisbee, one of my favorite places to go. But the lack of healthcare resources really impacts the health of those down there, and also the social services. Right, there's limited social services. So our ability to identify those gaps and work with the community resources, work with the providers to get those needs met. That's really what our role is there. We do a lot of telehealth visits. I'll tell you, this is another great thing. During the pandemic, we had not really done that much telehealth. But during the pandemic, we still needed to see people. We still needed to talk to them. And I was very concerned as to how are we going to do this. But what we found was that elderly population, those seniors, they all have smartphones. We would call them up. We would text them. We would say, "Hey, we're gonna do a face-to-face with you via this app, and let's test it right now." And we did it. And so from that point on, we were able to really create even a stronger connection. So during the pandemic, we did the telehealth. We are also picking up 25 food boxes a week and getting them delivered. We were delivering thermometers and masks and all of those kinds of things. But that connection through the telehealth, that's been phenomenal.
Have you run into problems in the rural areas in terms of connectivity? I mean, you talk about Bisbee, you talk about, people think of Arizona, they think of Phoenix. And,
Yeah,
and Phoenix is just a small speck on the entire state.
Right.
I mean, the state is huge.
It is huge.
And while we have, I think it's like 6.4 million people that live in our state, 4.6 live right here in Maricopa
Exactly.
County. So, it is extremely rural, and connectivity could be a problem.
We really haven't.
Nice.
We really haven't. I would say, to be very transparent, the biggest issue is when we're really close to the border. We're flipping between Mexico internet or Wi-Fi and the United States Wi-Fi. So we really haven't had connectivity issues.
Nice.
All of our employees have computers and laptops, and they're taking them into patients' homes, and that's how we run. So,
well, you know what? I would imagine your team logs a lot of miles, and
They do.
And whether it's cars or helicopters or planes,
helicopters would be awesome. Yeah, we supply company cars, and they do a lot of traveling. I got into one of the company cars yesterday, and I was like, oh my gosh, this car has over 100,000 miles on it. But to your point, from no matter where you are in rural, you're not going to get there in 5 minutes.
Right.
It's a little longer than that between patients' homes.
And I want, as we wrap up our second segment here, patients, aren't actually looking to find Adobe Care and Wellness. You're contracted with some of the
Right.
healthcare providers, and
Right.
and these are members of those healthcare providers.
Yes, absolutely. We contract with Medicare Advantage plans, and through that we get a roster of patients, and then We do many things to that roster. One of them is a risk stratification tool, which identifies who's at greater risk for in need of services, and then we reach out to them. So by the end of the year, we have contacted, we currently have, our largest contract has 20,000 lives. So by the end of the year, we have contacted those 20,000 lives at least one time.
Wow. Well, when we come back after halftime here, I want to talk about how hard it is to get them to go see their primary care physicians. Because, you know, I know this about the Medicare Advantage plans. They have people sign up, but if they are not getting in to see their PCP, you know, they don't know what their health conditions are like, and they don't understand what those risks are that you talk about.
Exactly.
You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Jayme Ambrose here in the studio from Adobe Care and Wellness. Stick around. It's halftime. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I've got Jayme Ambrose here in the studio. She is the founder and CEO of a company called Adobe Care and Wellness. They're an integrated healthcare solutions company. They're utilizing innovative proprietary software and in-person wellness care to assess, track, and improve outcomes and quality of life. If you've missed our first half, go out to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch that first half and many more. So, Jayme, when we left off in the first half, you know, I talked about the challenge that we have with getting members of Medicare Advantage plans to get in to see their primary care physician. And I think that's the kind of stuff that keeps, I would think, Medicare Advantage, you know, senior staff, leadership up at night. And it's like, you know, I don't know what we don't know, because they're not getting in to see somebody so we can really understand what their health is.
Right, absolutely. That's one of the key issues, and we've done a lot of data analysis looking at what happens when you don't go to your primary care doc. And one of the key things that happens is you're going to end up hospitalized, because exactly what you're saying, Bob, you don't know what you don't know. You may be pre-diabetic, but you're not being treated for it. You may have high blood pressure, but it's not being managed, which is easily managed. But you don't know those things because you're not going to your primary care doc, at least on an annual basis, right, to get that annual wellness visit. So some of the things that we do is we send a nurse practitioner into your home to do that annual wellness visit and to identify the risks that you have. All of that information then goes to your primary care with an idea, hey, maybe you need to follow up with them, and we strongly encourage that. The other thing that we do is once you end up in the hospital, we're going to call you as soon as you're discharged, and we're going within 24 hours, and we're going to help make sure that you've set up your follow-up visit following that hospitalization. Because what our data shows is that if you don't do that, you don't see your PCP after your hospitalization, you have a 75% chance of being readmitted within 30 days.
Wow. That's incredible. But this is something that you're doing for the plans that you are contracted with.
Yes.
I mean, they've bestowed that responsibility to you and to helping them, you know, monitor the health of their members, but make sure they're improving and following whatever, you know, recommendations that a nurse practitioner or a family physician or primary care physician would recommend.
Yeah, absolutely. We also help them get to their specialty visits. If they are having trouble getting the referrals or they're having trouble with authorizations for different testings, we help them with all of that too. That's all part of the case management. One of my case managers says that case management is just like a big bowl of spaghetti, because you never know what piece is going to touch something else to make the outcome better. And that's really what it is. It's not just a direct line of we're going to do this, this, and this, because we're not working with widgets. We're working with human beings. So every time we go meet with a patient, it's a different process, something that they need education with or supports for, or the social determinant things that we've been talking about previously.
Sure. And when your nurse practitioner or whoever goes out to visit them, I mean, I think the secret sauce, and you told me about this before we even got our show started, is staying connected. Can you share with our listeners how you do stay connected? Because even if it's not a physical visit, you talked about using technology and phones and stuff like that, just making sure it's kind of like having a coach, right? Making sure that they're staying on their regimen that has been prescribed.
Absolutely. So those that are enrolled in our integrated case management program, they're being touched 6.7 times a month. And that could be that those visits are because the dietitian is now meeting with them, the nurse practitioner, the nurse in the home, the social worker. It could also be that we have set them up to what we call telewell calls. We're calling to remind them to take their medication, remind them they have a doctor's appointment, helping them set up transportation. So all of those things are to help them learn better self-care skills. And so the length of time that somebody stays in that integrated program is actually 72 days. And then we reevaluate in 30 days. Do they need to come back on? Are they still on track? And that's the process that we employ in order to help identify those social determinant gaps, get those resolved, identify the health literacy issues that need to be addressed to get those resolved, and then get them on that path.
How big is food insecurity in terms of the social determinants of health? I mean, we hear a lot about that, and especially since this pandemic.
That's huge. That's huge. I would say, and I don't have the number in front of me, but I would say that we have at least 7% of the population that we identify that are in need of food resources.
Wow. That's just so sad. I mean, it really is. And I mean, I love what you guys are doing to problem solve for that. But you're just talking about overall. I mean, we have about 7% of our population.
Yes, absolutely. And that falls right in with the overall poverty levels that exist here in Arizona with the senior population.
So I know we're getting ready to wind down our third segment here, but I do want to kind of give a little tease. You guys have a proprietary software product.
We do.
Can you tease that up for our fourth segment?
Absolutely. So our proprietary software is really focused on that case management component. I asked our software team, because we build all our own software in-house, I said, we really need a resource tool. And what they built was an app called Maslow, which allows individuals to answer questions related to those social gaps, and then it geolocates for them the closest resource to where they live.
Whoa, there's a great tease, because I want to dive a little bit deeper into that in the fourth segment. Jayme, time flies really fast here at Health Futures.
It absolutely does.
And it's so great to have you here on the show. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Jayme Ambrose. She is the co-founder and CEO of Adobe Care and Wellness. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our fourth segment. We're here with Jayme Ambrose. She is the CEO and co-founder of Adobe Care and Wellness. They are an integrated health care solutions company utilizing innovative proprietary software with in-person wellness care to assess, track, and improve outcomes and quality of life. And in there describes this proprietary software. And we just tipped on it a little bit at the end of the third segment. And its name is Maslow. And I would love for you just to kind of complete that,
Sure.
that scenario. And essentially, this is something that you have the member complete.
Yes. So how Maslow works is it's an app, and the app asks 13 questions. It asks questions, kind of what we've been talking about all along. Do you have enough money for food? Do you feel safe in your home? Do you have transportation to get to your appointments that you need to go to? Are you homeless? Do you have some place to live? So it asks those kinds of questions. And then what it does is it geolocates for you the closest resource to those things that you've identified. So if you've identified that you don't have enough money for food, it's going to geolocate for you the closest resource related to that, a food bank or a church or somewhere that they're providing meals. All of those things are going to be identified for you.
Nice.
And they get emailed to you. Or if you're utilizing Maslow in a doctor's office, they are printed out for you if that's what you want. Or they can be text to you, however you want them to come to you. And then what's going to happen is it triggers a notice to our social work team. And within 24 hours, our social work team is going to reach out to you just to ask you, do you need any additional supports? Do you understand how to contact them? So that it's not just, here's your list, go figure it out, but let's make sure that we're closing these gaps for you and assisting you in whatever way we can.
Love it. Absolutely love it. I love how you embrace technology and how, I mean, I'm just fascinated that you're doing all this work outside of Maricopa County because I know how much territory you have to cover.
It is, but it's been such a fabulous journey. Our mission statement is to positively impact the lives we touch, and we just do that every single day. It's been a blessing. I get emails from our nurses, which we ask them to send us all these positive stories, and they're always talking about how grateful the patients are for the services that we provide, for the caring that we give. And I think to your point, Bob, I said we are in the rural areas. So there's a limit to who's reaching out to them, who's touching them, who's investing in their health. And that has given us the opportunity to do that.
For me, because of what the work we do, the in-home care service, they sometimes call it non-medical, which I hate that term, but we're helping with ADLs, activities of daily living, and I would imagine it's hard to find resources like ours in these rural areas to help people with ADLs, and I think that's the biggest challenge that we run into with our aging population, is that somebody that has difficulty ambulating, making meals, remembering to take medications, makes it even more challenging in the rural areas.
Absolutely. Not only is there, we work very closely with the area agencies on aging, but not only is it for the non-medical, but it's also home health. The ability to get therapists to come to rural Arizona,
Right.
they struggle as well.
They struggle here now. This thing called Omicron, is wiping out, a lot of the clinicians that are usually visiting in people's homes.
Absolutely.
They're battling their own personal battles or family battles.
Yeah, it's been a very tough couple of years for healthcare workers everywhere to be able to meet their patients' needs. Absolutely.
So as we wind down our show, I want you to tell me a little bit about this affiliation you have with Desert Kidney Association.
Yeah, great. I just met with Dr. Sahani last night. So we just formed a partnership with Desert Kidney to create a case management program that complements what the nephrologists are doing. So Medicare has different pilot programs that they're doing. One of them is dealing with chronic kidney illnesses, the chronic kidney and dialysis patients. So working with Desert Kidney and our case management to focus on how do we strongly manage that population. Number one, addressing their social determinants. Number two, making sure that they get to their doctor's appointments and to their dialysis appointments. I mean, the number one reason that someone with chronic kidney disease who's on dialysis goes to the hospital is because they can't make it to dialysis. So we're making sure those kinds of things are being done. The other key piece is looking at depression. Depression with those who have long-term chronic illness is a very high risk. So we're we're evaluating them for depression and then helping identify what services they need in order to resolve that. Again, it's about addressing the quality of life and how do we make it better.
Sure. And you talk about depression. I mean, one of the things that's not really spoken a lot about is alcoholism and how prevalent it is with the older adult population. And none of that can be good for someone's health, especially their kidneys.
Absolutely.
Absolutely. Jayme, we're getting ready to wind down our show. And, I typically will ask our guests, is there a question I haven't asked? Or is there something you would like to leave with our listeners relative to, Jayme Ambrose and what Adobe Care and Wellness does, because I'm fascinated about, what you have done in the last 5 years since I've last seen you, and you're making impacts on people's lives every single day. And the general public doesn't know that.
No.
But trust me, those Medicare Advantage plans, they know that because you're taking care of their members.
Absolutely. I think the most important thing is that I always want to share is the passion that we have for what we do. We truly, truly are dedicated to improving the lives of the patients that we touch, and that's our focus consistently. As you've talked a little bit about, we are a software company as well, and everything that we develop, from Maslow to our risk stratification tool to how we document to how we manage our employees, is all about how do we improve the outcomes for those lives that we're integrated with. And so the partnerships that we have, or we were just URAC certified. We're the only independently owned case management company in the state of Arizona that is URAC certified.
What's URAC mean?
So
we throw around acronyms all the time. So
absolutely. So URAC is like the JACO for hospitals.
Okay.
Joint Commission. So URAC is that accreditation that CMS recognizes as excellence.
Nice.
So that's what so we're very excited about that.
Well, you should be. You should be. And by the way, for our listeners, if you want to learn more about Adobe Care and Wellness, go to adobecw.com. Anything fun planned for the weekend? And we haven't really even talked in a while. What are you doing these days? What are some of your hobbies? Are you a football fan? We got the Cardinal football coming up, so.
We do when we can. We travel, and I'm an avid reader of history. So I usually have a stack of books that I'm invested in.
American history or history in general?
I'm reading. I usually have 3 books going at the same time.
Wow.
So I'm actually reading a book on the history of India. And its takeover by the East Indian Company, which is very, very exciting. I'm reading a book about, I read a lot about World War II and Churchill, and so all different kinds of things.
That's your jam.
That makes me a total nerd, I know.
No, listen, you know what? You have a lot of credentialing. You're an incredibly intelligent and bright young woman.
Thank you, Bob.
Who's making a difference in the lives of our citizens here in this great state of Arizona. Jayme, it's really great getting reconnected with you, and I love the work that you're doing. And for us, at Cypress Home Care, we know it is really about the entire continuum of care. It's the mind, body, and spirit.
Absolutely.
And we really need to make sure that our older adults are getting the resources that they need. And you're doing that every day. You're making differences in the lives of people that you serve. So thank you from me, and thank you from everyone that you are able to take care of.
Thank you, Bob. I appreciate the time that you've given me to discuss this. It's been great.
It's great having you on the show. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are going to be back next Friday. You make it a great day, and have a great weekend.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.